All right, hi guys, this is chapter 26. It's the last lecture for this class. And so it's going to be on management of lymphatic disorders. And so just to go over a brief review, I know you guys have covered lymphatic system, lymphedema, and things like that in your patho classes. So I'm going to talk a little bit more about it just from the therapy standpoint. So primary function of the lymphatic system. The lymphatic system is designed to collect and transport fluid from the interstitial spaces back to the venous circulation. So this is accomplished through a series of lymph vessels, lymph nodes. It runs very closely alongside the circulatory system. And then there's also a role in the body's immune function. And so if it's not functioning efficiently, lymphedema can develop. There are some diagrams in the next slide or two that sort of goes over and some of those other immune functions. That's why like the thymus and the spleen and are also considered part of the lymphatic system as well. I put a little video here. It's only about a 2-minute video clip. Just kind of goes over the basic overview of the lymphatic system, primary location, what it's made up of, primary function, things like that. So just take the 2 minutes and look that over just for a little bit of overview. So lymphedema is what we're primarily going to be talking about here. It's an excessive and persistent accumulation of extravascular and extracellular fluid and proteins. And that's one of the big things with lymphedema. It's typically a very protein-rich type of edema, and it's a little bit harder to get to go away than your usual traumatic type of edema. So lymphedema will start to occur when the lymph volume exceeds the capacity of the lymph system. And then also because it is more protein rich, it's going to draw larger amounts of water out with it into those interstitial spaces, which then leads to lymphedema. And again, that's osmosis, concentration gradients, how that all works, which we're not going to get too much into here. But again, here's one of those diagrams I was referring to, the anatomy of the lymph system. So it's an open system. Again, it's going to run very closely to your circulatory system, following like the arteries and veins through the area. The capillaries, again, are situated close to the blood capillaries because there is going to be some filtration between and some carryover between the two systems. So not only are they located closely together, but they're working closely together as well. So the lymphatic vessels are the really thin vessels in through here. They transport lymph from the lymph nodes to the lymphatic trunks. It's filtered and then it's sort of recirculated through the body. The body has somewhere between 600 and 700 lymph nodes. The largest grouping is going to be in the head and neck area, in the axilla, in the inguinal area, as well as in the trunk, through the thorax and in the abdomen, the lower intestines, and things like that. So here's just another picture. Again, different diagrams. It's again open system, and it's primarily located in the head, neck, and trunk area. You don't have nearly as many lymph nodes or lymph vessels in the extremities, so in the arms and legs. So there's two major types of lymphedema, primary and secondary lymphedema. Primary is pretty uncommon. It's the result of sort of insufficient development or congenital malformation of the lymph system. So the lymph system just doesn't develop the way that it should. Secondary is the most common type. It's the kind that we will probably be seeing in physical therapy, and it's typically related to the management of cancer. So typically we tend to see a lot of like upper extremity lymphedema after diagnosis of breast cancer, because what they do is typically use the lymph nodes as a diagnostic procedure. So when breast cancer is detected, they will take some tissue from there, and they'll also go to the axilla on that side as well and biopsy or take out, remove some of the lymph nodes, sometimes all of the lymph nodes there, and they test those lymph nodes to see whether or not the cancer has spread to the lymph nodes. If the cancer is not in the lymph nodes, then they generally tend to believe that it has been localized to the breast tissue. If it is in the lymph nodes, then there is fear that cancer has potentially spread to other parts of the body as well. And again, because of the lymph system running along with the circulation, if cancer cells are picked up, they can be transported. And because it's playing a role in the immune system, it's recognizing those cancer cells as foreign and trying to pick them up and filter them so they can be easily carried through the lymph system and easily detected there. So again, once those lymph nodes are removed in that adjacent axilla, that person no longer has those lymph nodes there to filter the fluid, and so they are at an increased risk of developing lymphedema in that upper extremity. We see lower extremity lymphedemas when we start dealing with some of our like pelvic area type cancers, so uterine cancer, cervical cancer in females, prostate cancer in males. Same thing, if any of those types of cancers are detected, they will oftentimes take the lymph nodes, or at least some lymph nodes in that area, to test them to see if cancer has spread anywhere. So again, here's secondary lymphedema. It's classified due to the cause. So surgery, again, surgical removal as part of a treatment or diagnosis for cancer, which we just talked about. Inflammation or infection, this could be some sort of systemic infection or some local trauma to the area, which actually disrupts the lymph circulation. Obstruction or fibrosis is also fairly common with the lymph system. This can be from trauma, surgery, or even the cancer itself. Tumors can block the lymphatic system if they grow to be large enough. The other big one is radiation therapy. So oftentimes people receive radiation therapy as part of their cancer treatment, and that can actually cause the lymph vessels to fibrose. And so when they harden like that, they're not going to transport fluid the way that they should. And then again, lymphedema can begin to develop. There's also combined venous lymphatic dysfunction. This is typically seen along with chronic venous insufficiency, which I think you guys have talked about before as well. So we're not going to get too much into that. But with the venous insufficiency, we start to see the swelling in the lower legs. The veins are not working as they should, returning blood as they should. So it starts to pull in the lower legs. We start to see swelling and edema start to form there. It starts out as more of the venous type swelling, so it's a dependent peripheral edema. If the limb is elevated, that's going to help. It's going to make it feel better. It'll actually reduce the edema. But then over time, what happens is the lymphatic workload, it has to increase. And because of all the swelling that's already accumulated in the area, it starts to actually collapse some of the lymph vessels. They're not able to return fluid or protein as well as they should. And so then we also get some lymphedema that develops on top of the venous type edema. So we've got a little bit of both going on there. So the severity of edema, we're going to talk about stages in just a minute, but some other terms that you can see as far as edema goes. One is pitting edema. I think this is a pretty good picture here of what that's going to look like right here. So the pressure on the swollen tissues will cause an indentation of the skin, and it lasts for several seconds. This typically is not associated with fibrotic changes just yet. But it's a pretty significant type of edema, right? So you can actually stick your finger or thumb into that, and that fingerprint remains there for several seconds, where usually as you just press on edema and normal edema, and it sort of springs right back. Brawny edema is more of like a hard fibrotic type edema. There will be some fibrotic changes in the subcutaneous tissue. It is a more severe form, and it's named for the color. So you can see in this picture, the limb has actually started to get this like purplish brownish appearance to it, and that is considered brawny edema. So there's obviously swelling here, but you also have this discoloration as well. And then lastly is weeping edema. It's the most severe. It's usually due to a long-term lymphedema problem. And you'll see that fluid is actually leaking from the limb. These are limbs that are usually quite large, quite swollen due to the lymphedema. And because of all that buildup of fluid, it truly has nowhere else to go. So it actually does start to leak out through the skin pores. It can also come if they have any like cuts, wounds, anything like that. They're going to tend to weep a lot too. We typically see this more in the lower extremities, not nearly as much in the upper extremities, but you can usually tell because it has kind of like a shiny appearance, and so you can kind of see that a little bit in this picture here. So the stages of lymphedema. Let me put this out here right now, clarify it right from the beginning. These are the stages 0, 1, 2, and 3. I just liked this picture, but we stage it stage 0, stage 1, stage 2, stage 3. So go with the stages that are listed here. This is what is in your book. This is just what was on the picture. Okay, so ignore the stages up here. Look at the stages over here. So stage 0 is considered the latency stage. Stage 1 is reversible. Stage 2 is spontaneously irreversible. And stage 3 is typically your elephantiasis. So severe, significant edema there. So stage 0, again, this is the latency phase. There's no outward swelling. The person's pretty much asymptomatic. They might feel like some achiness or heaviness occasionally in the extremity. And even though there is that decrease in transport capacity, their body's still pretty much able to process the lymphatic load. So they're able to do all things. They're not noticing a whole lot of swelling, but there are some things, and we'll get to these a little bit later, like patient education type things that we should teach them to try to make sure they stay in this phase. Really, the best treatment for lymphedema is prevention. Just preventing it from occurring in the first place is going to be a lot easier than trying to get it to go away once it forms. So stage 1, this is the reversible stage. So elevation is going to reduce swelling. There's no tissue fibrosis yet. The swelling is still soft. It may progress to even some pitting edema. But at this stage, we can still get in there and do treatment, and we can get the swelling to go away, which is a good thing. So again, if we can get people in therapy at this point, that would be ideal. Unfortunately, because elevation takes it away, they can usually get it to go away on their own, and they don't always seek therapy or medical attention at this point yet. Stage 2 is your spontaneously irreversible stage. So now we actually do get to see some fibrosis of the tissue. You might start to see some of that brawny type edema. It becomes more of a hard swelling. It's no longer that pitting edema. You can't really leave a fingerprint in it anymore. It's become that sort of rigid or firm. There is a positive STEMMER'S sign, which is what they're testing in this picture right here. And frequent infections may occur as well. So they might get wounds or skin infections, cellulitis, things like that are pretty common in this stage. So to go back to this picture, and there's a slide, I think it's the next slide or two, of what the STEMMER'S sign is. What they're doing in this picture is for the lower extremity, they try to take a pinch of skin fold or take a pinch of the skin there, right at the base of the second toe. For the upper extremity, they'll take it on the knuckle of the middle finger. So if you can actually lift up a piece of skin, that's a negative test. If you can't, because there's so much swelling there, that is a positive STEMMER'S sign, and that is again a sign of some more advanced lymphedema. With stage 3, again, this is the elephantiasis stage. We expect a positive STEMMER'S sign with this as well. There will be a significant increase in limb volume. We might see some hyperkeratosis, papillomas, deep skin folds. So think back to that picture I showed you with the elephantiasis, all those like skin folds that were on that leg because of the amount of swelling that was there. And there are increased incidences of bacterial and fungal infections of the skin and nails on that extremity. So again, here's the explanation of the STEMMER'S test or STEMMER'S sign. So again, we're using that as a diagnostic tool to show lymphedema. And again, it's at the base of the second toe or the middle finger of the upper extremity, and just trying to pinch up a piece of skin. If you can, it's negative. If you cannot, because it's so swollen, then that's a positive test. Just keep in mind too, a negative test doesn't necessarily rule out that they have lymphedema. It just might not be that advanced yet. So some of the clinical findings and impairments that we'll see in our patients who have lymphedema, obviously an increased size of the limb, which can cause a decrease in range of motion, stiffness, pain, weakness, and will eventually cause functional limitations as well. There may be some sensory disturbances as well. They may get some numbness or tingling or pain in that extremity. And as I mentioned, there is a decreased resistance to infection as well. So we do need to be very careful whenever we're working with them and teaching them about, good hygiene habits and things like that to try to reduce that risk. Big things for management and treatment of lymphedema. Manual lymphatic drainage is one of the big things. This is kind of more of a specialty area of PT. I have gone to some weekend courses and have a decent amount of CEUs in lymphatic treatment and manual lymphatic drainage. And one of the big things with this is it's a very light touch massage. It's a very systematic, light touch massage. I have included a video here. These are some techniques for self-manual lymph drainage, which are good, but they're probably not as good as having it performed by a therapist. So as a therapist who's performing manual lymph drainage, this is going to be probably a 30 to 40 minute treatment session of just the manual lymphatic drainage. And like I said, it's very systematic. Typically, we start with the patient supine on the table. We'll elevate whatever extremity it is that we're going to be working with, and we start with deep breathing exercises. So there's a slide a little bit later on talking about the importance of deep breathing, but deep breathing just sort of helps to sort of stimulate the lymphatic system. So we do a series of deep breathing exercises. We work on what we call opening the watersheds. So what you have to do is all of those lymph vessels that are along like the sternum, the trunk, in the neck, because there's such a high concentration there, we need to kind of try to open them up first. So we typically start very proximal. We start in the trunk with our massage, and then we start to work our way out distal. Again, the idea is if, say, we're working on lymphedema of someone's upper extremity because they've lost lymph nodes in that axilla, we have to try to basically mobilize all that fluid to where there are more lymph nodes. So most times what we're doing is we're trying to take that and bring it over to the other axilla where it can then be filtered through those lymph nodes. So again, deep breathing exercises, opening up the lymph nodes in the neck, the chest, the opposite upper extremity, and then we start maybe like up at the shoulder and try to bring that fluid over. Then we'll go down into the upper arm and bring that fluid over, down to the elbow, down to the forearm, and then finally down to the hand and bring all that over. So it's systematic, it's very planned out, it starts proximally, and then you gradually work your way distally. Light touch, it takes a decent amount of time to do it properly. So the idea is we can get our patient in, do some manual lymphatic drainage, and then hopefully do some compression therapy afterwards, because again, over time, that fluid will start to reaccumulate. So we can do intermittent compression with them. I have done a combination of some manual lymphatic drainage along with some intermittent compression as well as some bandaging. This is a video here that shows you how to wrap an upper extremity for lymphedema. There's definitely some variations in how you can do this. I can't say I would do everything the exact same way that they are, but they hit a lot of the same points that I would. So take a look at it and see. Some of the biggest things, and I do have a box of wrapping supplies for lymphedema in the lab, so if we get into lab or when we get into lab, I can show you those, but it does have, it uses more of a low stretch bandage, so it looks like an ACE wrap, that's essentially what we're using, but it doesn't have the same amount of give that the ACE wraps do that you would use for like residual limb bandaging. These are going to provide a bit more compression than those do. So we use those, we use some foam padding in between, we'll use some sort of protective barrier on the extremity as well. So take a couple minutes and watch that video as well so you have an idea of what that is going to look like. Again, because we're wrapping an entire extremity, it is a little bit more time intensive. We could also use compression garments. So if your patient has their own compression garments, they can put those on, or you may have to help them put those on when they're done with treatment. So another part of their treatment program is going to be, again, instruction in proper skincare and hygiene because of that increased risk of infection, especially if there are skin folds or anything like that. We want to make sure that they're taking extra special precautions and extra good care of that. And then exercises. I did include a video. This is just one video about some different exercises for the upper extremity. It starts with some neck exercises, just really some range of motion. It's going through a lot of range of motion of the upper extremity as well. And so the idea here is just to try to activate the muscles without really overstressing them, which will help to sort of pump some of that fluid out of the area. We do want to be careful that we don't overtax or overload the area, because again, any type of trauma that's sensed by the body can lead to increased inflammation and increased swelling. So we do have to take it a little bit easy with our patients who have lymphedema, especially on that particular extremity. So again, some exercises, we should typically start with some deep breathing. Again, if the idea behind our exercises is that we want to activate muscular pumps and try to mobilize some of this fluid, we want to make sure that the lymph system is stimulated and responding and going to be able to move some of that fluid. So deep breathing can help with that. So I would have your patient just start with that. They don't need to do a ton, just a couple minutes to kind of get started. Flexibility exercises. So again, like you saw in the video, they were doing a lot of cervical and upper extremity, obviously working on someone who has upper extremity lymphedema. If it were for the lower extremity, again, focus more on the trunk, the legs, but more on like range of motion and flexibility type exercises. We can absolutely do some strengthening and muscular endurance, absolutely use low weights. I'm not even going to say like true endurance with low weights and high reps, because we don't want to start with high reps just quite yet either. A gradual progression. So really light weights, start with low reps too, and see how your patient responds to that. Again, it's much easier for them to come back and be like, I feel completely fine. I feel like I almost didn't do anything. Okay, then we can add a little bit more versus I really overdid it. Now I have all this excess swelling. So we don't want that to happen. Cardiovascular conditioning as well. Any type of aerobic activity, we know that walking, just using the leg muscles, will get the calves going and start to pump some of that fluid. So any type of cardiovascular exercise that they can tolerate is going to be beneficial for them. So again, the benefits of exercise for lymphedema, again, the muscular contractions are going to help to pump and remove some of that fluid. It reduces static positioning, right? The longer that you're still, the more likely it is for fluid to start to build up in that area. So the more we can keep moving, the less likely that is to happen. It also prevents atrophy of the muscles, which again increases the efficiency of the pumps to remove some of that fluid. An increase in heart rate can also help to increase lymph flow, because again, the lymphatic system working so closely with the circulatory system. Again, sequence things to try to clear those lymphatic reservoirs first and then work your way out towards the periphery. So again, starting with exercises more for like the trunk, the core, and then working your way out from there. And if you exercise while they're wearing the compression bandages, that should help to enhance the lymph flow as well and limit any fluid from building up in those areas, if they can exercise while wearing those compression bandages. I know in some of the compression wrapping that we did, it would have been very difficult to do a lot of exercises with that. So depending on the amount of compression that you're using with that, they may or may not be able to wear them while they're exercising. And again, like I said, the best thing to do here is really prevent. So patient education. So again, the more they can get moving, the better off they're going to be. Sitting or standing for long periods is not going to be good for them. So if they are traveling long distances by car or especially by airplane, stop periodically, walk around, get up and move around as often as they can. When you get into air travel, the altitude starts to play into that as well. We want them to try to elevate the involved limbs as much as possible, do some pumping exercises during the day, so ankle pumps, ball squeezes, anything like that to get those muscles working. Again, be pretty cautious about doing really vigorous exercises with the involved limb and monitor the weights that you're using. Again, light weights are usually okay, but just keep a track of that, keep track of what you're using and how the patient's responding to that. If at all possible, carry things on the opposite side. So if it's an upper extremity, try to carry heavy luggage, heavy bags on the opposite side. Wear compressive garments while exercising if possible, or maybe afterwards if it's not possible. Clothing and jewelry that doesn't leave a mark or imprint on the skin, that is sometimes one of the first signs that lymphedema is starting to develop. Rings are fitting tighter, watches are leaving marks in the arm, bracelets, things like that. So that's sometimes how people start to notice the signs of developing lymphedema. As far as diet goes, nothing special, just minimize sodium intake, which makes sense because if you eat a lot of sodium-rich foods, you're going to retain more water, more fluid, so that'll be harder to get rid of. And then if at all possible, too, have your blood pressures, blood draws, anything like that performed on the contralateral on the other side. Again, just trying to minimize any trauma to that involved extremity. All right, that's it, guys. Thanks.